When you're pregnant, your baby is housed in an amniotic sac inside the womb, and inside the amniotic sac there's amniotic fluid. What's up, beautiful people? Welcome to another exciting episode of Labor Room with Dr. O. You already know I'm your pregnancy partner, and I'm a proud one at that. I remember we're in this pregnancy journey together, okay? I'm not going anywhere until you give birth to that baby successfully. Anyways, so today I received a message from one of our subscribers, and she was asking me a serious JAMB question. If you're Nigerian, you know that JAMB questions are not the easiest questions to answer. Actually, I get this question a lot, right, from different people. I've gotten this question so many times, but she just asked the question again, and I thought, well, let's make a video out of it so that everyone can benefit from the answer I'm going to give to the question. So basically, the topic we're discussing today is about sexual intercourse in pregnancy, right? I got a message, and the person said, she asked, and she wanted to know that, is it safe to have sexual intercourse in pregnancy, or is it safe to have sex when you're pregnant? Pretty much. So let me start by saying, first of all, that when you're pregnant, right, your baby is inside a sac called the amniotic sac. And if you're a regular viewer of the Labor Room series, you know that, or if you're a regular listener, for those that listen to the podcast, I hope you guys know we have podcasts, right? So if you don't want to watch videos, you can always listen to the podcast. We're listed on every podcasting provider, whatever they call it, that is available. We're on Apple, we're on Google Podcasts, we're on Amazon Music, we're on TuneIn, and so many others. Anyways, back to the topic. So basically, if you watch Labor Room regularly, you know that I've described this before in my video, 3 guaranteed signs of labor. I'm going to link it down below. Anyway, so your baby is in a sac called the amniotic sac, and inside that sac there is fluid called the amniotic fluid, right, that is protecting the baby from mechanical injury and all that. The sac is actually a thick sac, right, and part of the functions of this sac is to form a barrier. So that barrier protects the baby from any infection that you might possibly have, right? Now back to the topic. Is sexual intercourse safe during pregnancy? So first of all, you need to know that so far, as long as everything is equal in your pregnancy, like you don't have complications, which I will talk about later in this video, right? As long as you don't have any complications, your doctor never told you that, oh, it's not safe for you to have sexual intercourse, right? Every pregnant woman is okay to have intercourse during pregnancy, and it doesn't matter how you choose to have intercourse, whatever position, whatever styles, how often, right? Your baby is going to be fine, right? Sexual intercourse is not going to cause any form of harm to your baby. You don't have to worry that something is going to happen to your baby. There's going to be any mechanical injury to your baby while you're having intercourse. No, nothing like that. Yeah, maybe the baby might be wondering that, why is mommy moving around a bit too much? What's going on? That kind of thing. But apart from that, baby is fine. I mean, if the baby is sleeping, maybe you wake the baby. I'm just joking. I mean, I have a very wild imagination. But yeah, long and short of the story is, your baby is going to be fine, okay? Except, of course, you have complications, which I'm going to discuss later in the video, like I already mentioned. And miscarriages. On the topic of miscarriages, some people have the notion that if you have sexual intercourse in pregnancy, it might lead to a miscarriage. So ordinarily, if everything is fine with you, you don't have any complications like I mentioned, sexual intercourse in pregnancy at whatever stage of pregnancy should never lead to a miscarriage, okay? Most times miscarriage happens due to a variety of other reasons, which I'm going to talk about in another one of my videos in my TTC diary series, which you should definitely look out for. But today, like I said, we're talking about sexual intercourse in pregnancy, and no, it doesn't cause miscarriages under normal circumstances. However, having said this, there are actually times when sexual intercourse is contraindicated in pregnancy. So contraindicated is kind of like a medical term for forbidden, right? If you have certain conditions, you are not supposed to have sexual intercourse in pregnancy. So for example, if you have cervical incompetence. So what's cervical incompetence? Like I explained in one of my previous videos, cervix, right, is the neck of the womb. So it's what keeps the womb closed throughout your pregnancy. The only time the cervix is supposed to open up is when you're about to go into labor. So for you to be able to successfully deliver your baby, the cervix has to open up all the way to 10 centimeters, and then you can push your baby. So the cervix should always stay closed throughout your pregnancy. However, some people have what we call cervical incompetence. This is when the cervix begins to open up before, you get to full term, or before the right time for labor. So for example, full term is usually 40 weeks, right? Some people can give birth obviously 38 weeks, 39 weeks. So 40 weeks plus or minus 2 weeks, right? Now, some people, even in their second trimester, their cervix starts to open up before the labor, and that leads to preterm labor, right? So those kind of people, we say they have cervical incompetence. So it's usually common in the second trimester. You don't see it in the first trimester, but usually in the second trimester, that's when you see it, and usually leads to miscarriage or preterm labor, which nobody wants, right? So if you've been diagnosed to have cervical incompetence and maybe they had to do a cerclage or something for you, you need to check with your doctor after the cerclage to see if it's okay to have sexual intercourse. But ordinarily, when you have cervical incompetence, you should not be having sexual intercourse because you are putting yourself and your baby at risk of preterm labor. Another condition where you should not be having sexual intercourse is if you are leaking or you are draining amniotic fluid. So like I said before, when you are pregnant, your baby is housed in an amniotic sac inside the womb, and inside the amniotic sac there's amniotic fluid. So if the only time that amniotic fluid should actually be released is when your water breaks, right, during labor. So if for any reason you are draining amniotic fluid, right, before the right time for labor, then there's a problem, because that means your baby is exposed. That barrier that was protecting the baby has been broken, and your baby can be exposed to a series of infections and so much complications because there's not going to be sufficient fluid to protect the baby from mechanical injury. So if you are draining amniotic fluid, of course your doctor is going to advise you to abstain from any form of sexual intercourse, and there will also be other interventions which your doctor or healthcare provider would administer or would take, right, to solve this situation. But if you've been diagnosed as draining amniotic fluid, please abstain from sexual intercourse for the safety of you and your baby. Another condition where we normally advise against sexual intercourse in pregnancy is if, for example, you have a condition called placenta previa. So this is when, like, your placenta, right, covers the opening completely or partially, covers the opening of the cervix, the neck of the womb that stays closed throughout the pregnancy. So if that happens, it could expose you to bleeding at any time during your pregnancy. So we usually advise that you abstain from sexual intercourse in instances like this, right? So if you've been diagnosed with placenta previa, then you should abstain from sexual intercourse for the safety of yourself and your baby. And then the last instance that I would like to talk about today, right, is if you have a history of preterm or premature labor. So what does that mean? That means that you go into labor before you reach full term. So for example, like I already said earlier, full term is 40 weeks. So if you're going into labor anytime before 40 weeks, then you might, if you have a history, like in your previous pregnancies, you've gone into labor anytime before 40 weeks. So okay, let me break it down like this. There's early term, there's full term, and there's late term. Early term is like from 37 weeks, right? And that's okay. Full term is 40 weeks, which is okay. Late term is, above 40 weeks, which is also okay, but we never like the pregnancy going past 42 weeks because that's dangerous for the baby, right? So when I'm talking about preterm labor, I'm referring to anything before 37 weeks of pregnancy. So if you have a history in your previous pregnancies, I'm not saying if you had a CS and they took out your baby before that time, that's different. If you actually went into labor before 37 weeks of pregnancy in your previous pregnancies, then you might want to abstain from sexual intercourse because there's actually risk of that happening again, right? And trust me, you don't want that to happen because there's a lot of complications that might happen as a result of preterm labor. So this is one of the instances when you should definitely avoid sexual intercourse in pregnancy. So basically, I hope I've been able to answer your question about whether or not it is safe to have sexual intercourse during pregnancy. Of course, like I said, it's always better to consult your doctor on a one-on-one basis because your doctor knows your medical history. He knows your current history, your current medical situation, right? Your doctor would know if you have any of these things I mentioned or even other things that may prevent you from having sexual intercourse during pregnancy. But the advice is generally, if you don't have any complications, if you don't have any conditions or anything, then it's okay for you to have sexual intercourse during pregnancy, right? There's totally nothing wrong with it. Pregnancy does not mean sexual intercourse stops, right? Because I know that some men, once their wife gets pregnant like this, that's the end. They will not even go near the wife like, you're pregnant. No. For the whole 9 months they won't tell their wife. Guys, that's not nice at all, right? That's not nice. Your baby will be fine, your baby will be all right? If you need extra convincing or whatever, you can follow your wife antenatal clinic, right? Speak with her doctor, speak with her midwife, right? Ask questions and they'll be able to advise you better so you can feel safe and you can feel all right, because actually for some women during pregnancy is when their libido even increases more. For others, maybe that's when it drops, but for some others, that's the time when they have the highest libido, right? So I mean, it varies for different women, right? And you don't want to be depriving your wife. At the same time, you don't want to be depriving yourself, because in some instances you're actually depriving yourself because you think that if you have intercourse with your wife, something's going to happen to your baby and all that. So whatever the case may be, generally it's safe, generally it's okay, but always check with your healthcare provider and they'll be able to advise you best based on your individual situation. Like I always say, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.